But a lot of health news have been coming out in the last couple of months, I would say, really on this. And Sarah Mayberry is our medical producer. She works with Dr. Frank McGeorge a lot. And we asked her to come on today talking about the newest obesity medicine drugs, which I think is fascinating. And I know, I'm sure a lot of people are asking you questions about what this all means for the treatment of chronic obesity.
Well, I was joking, there's an endless appetite for news about these drugs.
There you go.
And researchers are supplying us with that research because they have been studying these for quite a while. We are seeing the fruits of all that labor that has been going on now for decades in finally getting these drugs to the point where they're coming to market for weight loss specifically. They've been used in people with diabetes for a while now, but now this is the key where the FDA has now approved 2 of these for weight loss specifically. So,
and what it is, so we're seeing 2 different names of the drugs, but it's essentially the same drug, just being a designated use for 2 different things. And so Zepbound was the one that was just approved this week, and that is actually the diabetes drug Mounjaro, if you have heard that before.
Yeah, it sounds like galaxies or planets in Star Wars, right?
Exactly. We were talking about how they come up with all these names for these things. So,
yeah, Zepbound is really exciting because they found in the research that it reduced the risk of heart attack, reduced the risk of stroke, and reduced the risk of death from any cardiovascular event in people who were overweight but didn't have diabetes. And that's the key, because we knew that they worked in people who were overweight, obese, had diabetes, but would it work the same in people who didn't? And it did.
It's interesting because when we look about how these drugs work, it's really something that it's changing the hormonal response that we have in our body. It's not just an appetite suppressant, but changing the way our our blood sugar and keeping it a little bit lower. Is that how it's?
Well, here's the thing. When you gain a lot of weight, it basically short circuits the hormones in your body that tell you when you're full, that drive your cravings. And so when you've short circuited those, that's why diet and exercise don't work for a lot of people, because their hormones they're out of whack.
They have an entirely new pathway, and they want to continue there.
Exactly. Right. And so what these drugs do, and there are different ones for different drugs, but what they are basically doing is you eat an amount of food, and these hormones, they're like a hormone replacement. They mimic the hormones that are telling your brain, you're full, don't eat anymore. They suppress the appetite in your brain. They suppress that craving to eat more. And so that is what is allowing people to be satisfied and not eat more. The Zepbound actually has a second portion to it that mimics another hormone, and it actually helps you process like the sugar and the fat a little better. So it's a combo drug. So that's why it might have some better results even in terms of weight loss.
So we're hearing about this drug, and we're also hearing about Wegovy, which is the weight loss designated drug of Ozempic.
Correct.
Sarah, what are the biggest questions that you're hearing now from viewers about this? Because I don't think that there is really enough that people can read about it when we look at the number of people who are facing chronic obesity in the U.S.
Well, yeah, and chronic obesity, because right now, almost 40% of people in America, adults, are obese, and another 30% are overweight.
Is that according to BMI, or what's the measurement on that?
According to BMI, so the medical definition of it. So the audience for these, the potential patient group for these is huge. Number one concern is side effects. The immediate side effects are gastrointestinal, so the nausea, the vomiting, the diarrhea. Doctors I talked with said that most of their patients tolerate them very well. If you are taking it correctly and you're building up in dose, your body gets used to it. Long-term side effects, I think, is the question everyone wonders. You know, anyone who lived through fen-phen is like, wait, is there another shoe that's going to drop? So far, the studies look good. There is a warning on some of these drugs about a potential higher risk of thyroid cancer. So if you have a risk of thyroid cancer, you're not supposed to take them. I think we all want to see more long-term data. We all want to make sure that long-term they are safe if millions and millions of people are taking them. The other big issue is price.
And that's what I was going to say. When you say millions and millions of people taking this with no end in sight, the price.
This would be a chronic drug. This is something that people would take for the rest of their life, potentially. So, and they're expensive. I mean, if it's not covered by your insurance, which for weight loss alone, a lot of them are not, we're talking about over $1,000 a month. So that's a lot. Now, the question is, if it's proven to reduce the risk of all these other problems, if it reduces heart attack, stroke, even cancer, because there's 13 cancers that are linked to obesity,
then why wouldn't
insurance companies
why wouldn't the
cover
U.S. Preventative Task Force, would it be up to them to then look at that, or?
There's a lot of groups that would weigh in on this. Ultimately, it's the insurance companies that are looking at, the cost benefit. Is it cost effective for us to pay for this if it's preventing all of these other serious problems.
All right,
So
Sarah Mayberry.
research like this, though, is what may get us there.
I know, and I can only imagine, again, the number of emails that you guys are getting here and Dr. McGeorge and saying, all right, where should we go? But it's something that we're definitely going to be talking
We
about
are
a
going to
lot.
be following it. We are going to be talking about this for years to come.
Absolutely.
This is a pivotal moment.
All right, good stuff. Thanks so much, Sarah.
Thanks.
It's good to have you on.
Thanks for having me.
All right, we have a lot more ahead.